Picture this. A guy in his mid-40s works indoors, maybe a project manager or a tradesman who spends most of his day under fluorescent lights. He is tired a lot, gets every cold that comes around, and his back aches more than it used to. He puts it all down to stress and a busy life. Then one day a blood test comes back, and the number is so low his doctor actually pauses before speaking. That is the hidden story of vitamin D deficiency. It builds quietly for years, and by the time it shows up, it has already been doing damage. Most people think vitamin D is just about bones. You hear it as a kid: drink your milk, get some sun, keep your bones strong. And yes, bones are part of it. But that framing is so incomplete it is almost misleading. Vitamin D is not just a bone mineral. It is a hormone that touches your immune system, your muscles, your heart, and your overall mortality risk. The bone story is the beginning. The hidden risks are everything that comes after it. Let me paint you a picture of what vitamin D actually does inside your body. Its most well-known job is to help your gut absorb calcium from the food you eat. When your vitamin D levels are normal, your intestine absorbs roughly 30 to 40% of the calcium you consume. When vitamin D is low, that absorption rate can drop all the way down to 10 to 15%. That means your body is getting less than half the calcium it normally would, even if your diet has not changed at all. Your bones are quietly being starved. Now here is the million-dollar question. How do you even know if your vitamin D is low? Because here is the thing, there are usually no obvious symptoms in the early stages. No rash, no sharp pain, no clear warning signal. Vitamin D deficiency is defined by a blood test measuring a compound called 25-hydroxyvitamin D. A level below 20 nanograms per milliliter is generally considered deficient. Between 20 and 30 is considered insufficient. Most doctors would like to see you above 30. Many men in midlife are sitting below that threshold and have no idea. So who is most at risk? This is where it gets specific and useful. Men who work indoors all day are at higher risk because sunlight on your skin is one of the primary ways your body makes vitamin D. Men who carry extra weight are at risk too, because vitamin D is fat-soluble, meaning body fat can trap it and pull it out of circulation. And men with darker skin are at higher risk because the melanin in darker skin reduces how efficiently UV light converts into vitamin D. Indoor work, extra weight, darker skin. 3 factors that stack on top of each other silently through your 30s and 40s. Sound familiar? If any of those 3 categories describe you, this is not the moment to panic. It is the moment to pay attention. Because the research on long-term deficiency is genuinely sobering. Studies have linked chronically low vitamin D levels to higher rates of infection, weaker immune responses, and increased overall mortality. That last one is worth sitting with for a second. Not just a higher risk of one specific illness, but a statistically higher chance of dying from any cause. That is a broad and serious finding, and it is one that does not get nearly enough airtime. Let us talk about infection specifically, because this one matters for everyday life. Vitamin D plays a direct role in how your immune system responds to bacteria and viruses. It helps activate certain immune cells that are your first line of defense. When your levels are consistently low, your immune system is running at reduced capacity. That means more colds, longer recovery times, and a body that struggles to fight off what it should be able to handle. If you are the guy in your office who catches every bug that comes through the door, low vitamin D might be part of that picture. Now let us move to muscles and falls, because this one is particularly important for men as they age. Vitamin D has a direct role in muscle function. It helps maintain muscle strength and coordination. When deficiency develops over time, muscles become weaker and reaction times slow down. This increases the risk of falls, and falls in midlife and beyond are a serious health event. A fall that results in a hip fracture, for example, carries a genuinely high risk of long-term complications. The connection between vitamin D, muscle weakness, and fractures is one of the most well-documented relationships in this entire area of research. Here is where the bone story comes back around. Remember that calcium absorption dropping from 35% down to 12%? Over years, that shortfall adds up. Your body does not just go without calcium. It compensates by pulling calcium out of your bones. This process, done repeatedly over time, leads to a condition called osteoporosis, where bones become porous and brittle. Most people think osteoporosis is a woman's disease. That distinction matters more than you might think, because men get it too, and they are far less likely to be screened for it or warned about it. Now let us talk about the heart. This is where the research gets particularly compelling for men in midlife. Long-term vitamin D deficiency has been associated with higher risk of cardiovascular problems. The mechanism is not fully settled in the research, but the association is consistent across multiple large studies. Vitamin D appears to play a role in regulating blood pressure and inflammation, two of the key drivers of heart disease. For men who already have elevated blood pressure or cholesterol, a chronically low vitamin D level is another variable sitting quietly in the background, making the overall picture worse. Most people get this completely wrong, so let me fix that. They assume that because vitamin D comes from sunlight, anyone who goes outside occasionally must be fine. But the reality is more complicated. The angle of the sun matters. If you live above a certain latitude, your skin cannot produce meaningful amounts of vitamin D from sunlight for several months of the year. The time of day matters. Sunscreen, which you absolutely should be wearing, reduces vitamin D synthesis. And as you age, your skin becomes less efficient at the conversion process. Going outside for 20 minutes at lunchtime in winter is not the same as getting adequate vitamin D. So what about food? Can you eat your way to adequate vitamin D? The honest answer is that it is difficult. Vitamin D is found naturally in very few foods. Fatty fish like salmon and mackerel contain meaningful amounts. Egg yolks have some. Many foods like milk, orange juice, and cereals are fortified with vitamin D, meaning it is added during processing. But the amounts in food are generally modest compared to what your body can make from sunlight, or what a supplement can provide. Diet alone is rarely enough to correct a significant deficiency, which is part of why this problem is so widespread. This is what your body is actually trying to tell you when you feel persistently fatigued, when your muscles ache without obvious reason, when you keep getting sick and cannot shake it. None of those symptoms are specific to vitamin D deficiency. They could point to half a dozen other things, which is exactly why this gets missed so often. But if you are a man in midlife experiencing a cluster of those symptoms, low vitamin D is absolutely on the differential list. The way to find out is simple. It is a standard blood test. You ask your doctor for it. That is the entire process. Now, when it comes to treatment, that conversation belongs between you and your doctor, full stop. What I can tell you is that vitamin D deficiency is one of the more straightforward nutritional issues to address medically once it is identified. Your doctor will look at your blood level, assess your individual circumstances, and make a recommendation that is right for you specifically. Do not go down the rabbit hole of self-prescribing based on what you read online. More is not always better with fat-soluble vitamins, and your doctor needs to guide that process with your actual numbers in front of them. Here is the practical takeaway for Craig, the guy who skips his checkups and is not sure what is worth calling the doctor about. Vitamin D is worth calling about. It is a simple blood test, it is usually covered, and it gives you a concrete number that tells you exactly where you stand. If you have not had your levels checked in the last couple of years, and you work indoors, carry some extra weight, or have darker skin, you have good reason to ask for it at your next appointment. You do not need to be symptomatic to ask. Preventive information is exactly what this test is for. Let me bring this back to where we started. That guy in the break room, tired, aching, catching every cold. He is not unusual. He is actually a very common profile. The reason this deficiency is hidden is not because it is rare. It is because it develops slowly, it mimics other things, and it sits in a blind spot between the symptoms that feel urgent enough to act on and the ones you just live with. The damage it does to bones, muscles, immune function, and cardiovascular health does not announce itself. It just accumulates quietly until something bigger forces the conversation. The good news, and I want to end on this, is that of all the health risks we talk about on this channel, vitamin D deficiency is one of the most identifiable and most actionable. You can know your number. You can have an informed conversation with your doctor. You can make a real decision based on real data about your own body. That is the whole point of what we do here. Not to scare you, not to overwhelm you, but to give you the information you need to walk into that doctor's office feeling like you know what questions to ask. If this video helped with that, subscribe, because there is a lot more where this came from.